Hello everyone, I'm Dr. Pyosaku, a physician from Myanmar. Today, I'm going to talk about the title named Now You See Me. You might think I'm referring to a famous movie, but actually I'm talking about a diabetes-related eye complication called diabetic retinopathy. As we all know, vision is extremely important. Impaired vision can affect a person's quality of life. Many people with diabetes worry about vision loss, but the good news is that early detection and prompt effective treatment can prevent most cases of severe vision loss. So now look at what retina is. The retina is a thin layer at the back of your eye, working like the film or sensor in a camera. It helps you see images clearly. Next, so what exactly is diabetic retinopathy? Over time, high blood sugar can damage and weaken the small blood vessels supplying the retina. This affects the retina and causes vision problems if not detected and treated early. The management is up to the stages. First of all, initial stage is background diabetic retinopathy. Here, there are some signals showing the blood vessels damage in the eye, but the vision is still unaffected. The next stage is non-proliferative diabetic retinopathy. Here you can see on the left side, there are more signs. It carries a risk of sight-threatening in the future. But don't worry too much. You don't need specific eye treatment yet, but you just need more frequent screening and risk factor control. Next, proliferative diabetic retinopathy. You can see on the right side, it's a serious stage where the blood vessels in the eyes are largely affected. Here you can see small fragile blood vessels started to grow. As they bleed, they cause visual impairment. This stage often seriously threatens your eyesight, so treatment should be started as soon as possible. Another condition to be aware of is diabetic maculopathy. This affects the central part of the retina, known as the macula. The macula helps you see fine details clearly. As a result, central vision can be affected as it progresses. It makes it harder to read or even recognize faces. Now we understand what diabetic retinopathy is. You may be wondering how it affects your vision. Now let's look at the symptoms. Early diabetic retinopathy is asymptomatic and is usually found during diabetic eye screening appointments, but in later stages it presents with the alarming symptoms like blurred vision, floaters. Here you can see dots and lines floating in vision, difficulty seeing in low light, and most importantly, sudden vision loss. When you got these symptoms, they don't always indicate you have diabetic retinopathy, particularly if you experience sudden blurring of vision or vision loss. You should your eyes checked immediately. So, who are at risk of developing diabetic retinopathy? Diabetic retinopathy can develop in any type of diabetes. Approximately 30% of adults with diabetes develop diabetic retinopathy. The risk increases as the duration of diabetes increases, but it's possible to reduce the risk by managing diabetes. In addition, it's important to check and manage the associated risk factors like blood pressure, lipids, kidney health, and smoking status. Keeping these under control helps reduce the risk and slow retinopathy progression. So, how do we screen for diabetic retinopathy? It's usually screened by taking photographs of the back of your eyes, called retinography. Earlier, I've shown you some examples of retina photographs. During assessment, eye drops may be used so your doctor clearly sees the more detailed picture of your retina. It may sting briefly, the procedure is quick, and the vision is unaffected afterwards. Sometimes, your eye specialist may recommend a special scan called optical coherence tomography. This scan takes detailed pictures of the retina and detects swelling or damage in the central part of the retina that can affect your vision. So, if you have type 1 diabetes, have your first diabetic eye screening within 5 years of diagnosis. If you have type 2 diabetes, check that diagnosis. If you're pregnant or planning pregnancy and have diabetes, perform it before pregnancy or in the first trimester. If you're an adult older than 12 years, your doctor will plan you to check for diabetic eye screening every 1 or 2 years. Here, I want to highlight the importance of regular screening. Early detection and treatment is most effective. In case you are diagnosed with diabetic retinopathy, there is no need to panic. Treatments are also available to protect your vision. Specific eye treatments are usually started in later stages as soon as possible to protect your eyesight. Firstly, laser therapy. We call it pan-retinal laser photocoagulation. It's a type of laser treatment targeted on the retinal blood vessels. This treatment keeps the affected vessels shrink and stop leaking. Then, some people may need regular eye injections using medicine called anti-VEGF. It prevents further damage to the retina and keeps the vision stable. In case you need laser treatment or an eye injection, please don't be too concerned. Your eye will be numbed with anesthetic drops beforehand, so you shouldn't feel any pain during the procedure. You may notice just some pressure or bright lights. If the retina is bleeding and there are a lot of scars in the eyes, your eye doctor may recommend an eye surgery. Here I want to tell you again that if treatments are started early and effectively, they can preserve our vision. While treatments can help manage diabetic retinopathy, the best approach is to prevent it from developing or worsening in the first place. So, how can we protect our eyes and preserve our vision? Your blood sugar should be well controlled, but the target could be different individually. The next one is you need to control your blood pressure and cholesterol. Regular exercise is good not only for blood sugar, but also for your eye health. If you smoke, you just give it up. As I repeatedly mentioned, regular eye screening and prompt treatment gives best chance of protecting your vision. So to wrap things up, these are the points we talked about today. Before we finish, here are the key messages to remember. Today's title means diabetic retinopathy can gradually affect the vision. If it isn't detected and treated early, what you see clearly today may become difficult to see in the future. Now you see me, but later you may not. Fortunately, this doesn't have to happen. With regular eye screening, good diabetes control and timely treatment, serious vision loss can be prevented. Now we've come to the end of today's video. Thank you for watching. I hope you found this helpful. Please take care and stay healthy.